have the slightest idea what I was getting into when I came out here. I just know when somebody asks me to help in the area of alcohol and drugs or about anywhere else, I'm going to help. And in developing Capri Trust, we are an IRD charitable trust, and part of our trust deed is to go out and help in the community anywhere we can. So I said, sure, I'll come. And didn't have the slightest idea what to expect. I have been in the field of addictive disease treatment for over 35 years. It's a long time. And I've been here in New Zealand for, I guess, 14 years now. I came over to be the trainer and developer. I need that one that says World Drug Day down there, right at the bottom in the middle. You see it? That's it. No, right next to that one. Right next to that one. I came over to New Zealand to work at Queen Mary Hospital down on the South Island. Some of you may have heard of Queen Mary. It is probably the best alcohol and drug treatment program in the Southern Hemisphere, except that the government closed it for lack of funding and other reasons. They had 108 beds down there, and the most wonderful program. There were two programs. One was called the Hamna program, and the other one was called the Taha Mari program. And one of the great treats in my life, coming from America over here, was getting involved with the Taha Mari program. It was particularly neat because it all operated Pan Maori separate from the other one, and it operated in a whanakai around the Marae spirituality, which fit in so well with the recovery model of the 12-step groups, AA and NA, which I'm a big proponent of. I just got downright excited when I found out that what I've been pitching all my life about addictive disease being physical, mental, emotional, spiritual, and family was exactly the four cornerstones of Maori health: physical, mental, emotional, spiritual, and whānau. And so it fit like a glove when I came in there. I ended up being the last of the CEOs before they closed the hospital, and I had helped a very responsible businessman. You know, anybody can get addictive disease. I'm just going to show you a couple of slides here in a minute, and I'm going to show you why anybody can get addictive disease. But my colleague, Guy Smith, had been a very successful businessman, and yet alcohol was about to destroy his life. He owned a number of hotels and properties and things, and he was about to lose it all. And through a doctor in Australia, we came together, and Guy got sober, and then he called me up about 7 months later and said, I bought the property next door to his family home in Mount Wellington, and he said, we're going to have a treatment program to help treat people like me, many middle-class professional people and their families. Now this is really good because it is important to understand that in New Zealand, most of the alcohol and drug treatment programs are funded through the government, and the funding is extremely limited. And since I've been here, almost 200 beds have been closed. Queen Mary had over 100. The Salvation Army Bridge program had 65 out on the island, closed. A place called that Care New Zealand ended up with, which was in Martin. They had 35 beds, closed. And so we, on a wing and a prayer, and some money out of our own pockets, and the fact that I didn't get paid for the first 3 years that we were there, we started Capri in a different model. The model was the fee-for-services. People who wanted to come there had to basically pay for it themselves. And we get a little bit of condemnation about that because some people think, I guess, sort of like Bradley was mentioning a minute ago, just because they got a lot of wealthy people at King's College, that it's not just as good of an educational institute as anywhere else. Well, we get normal people. The only difference is, instead of the ratepayers, the taxpayers paying for them, usually their granddaddy pays for them, or their father or uncle or aunt somewhere. Now the good thing about this is, last year we treated, we're not a real big program, we only have room for about 16 people. Last year we treated 108 people. Now the interesting thing is, that 108 people, had they not had the resources and been able to come into Capri, they would have taken up 108 beds in government-funded programs that already have 600 people on the waiting list. The last Ministry of Health numbers that I saw showed that there were over 600 people in New Zealand waiting to get into government-funded treatment programs. So I see us as being very synergistic. When people come into our program because they can pay for it, they leave a bed open for somebody who can't pay for it. We also are able on occasion to give some partial scholarships, as King's College was mentioning they do, and try to help people out. I want to show you a couple things real quick on this slide. See that where I was doing a presentation, that's not about the cops, where I said speed kills, I was talking about methamphetamine. I was talking about P. And that kind of, I don't need that. That kind of speed kills more people when you really begin to understand it. If you push that again. Now, I want to tell you something real brief about the brain. I call it the squash when I talk to my clients, and you're going to see a couple of them in a minute. You see, people who have addictive disease, like these fine young men here and the four I brought along, they're not bad people, need to be good. By and large, their sick people need to be well. And they need to be treated with a bunch of dignity and respect, like you would with people who have any other sort of problem, not with condemnation and with punishment. Although some people, when they are using alcohol and drugs, if they do the crime, you may have to serve the time, but making amends, repairing the wreckage of the past, is an important part of being able to hold your head high and stand up and feel like you're really worthy and get that self-concept back. That's what the brain looks like. Drug addiction is a complex illness, and it by and large works in these parts of the brain. Right in the middle, that little purple part that you see, I wish I had a, right there, good. That little purple part, I won't get into the scientific names and things with you, but that's where the reward center is. A part of your brain is designed to receive signals when something nice happens. When you pick up a little baby and hug them, it goes ding, ding, ding in there and it says happy, smile. But if you run across a lion in the jungle and it's going to eat you, that's the part of the brain that says run, and you run. But in any event, what happens is when we take alcohol or other mood-changing, mind-altering drugs, in the brain, it activates this reward center. For example, a pee pipe, a blast of pee, reduces more neurotransmitters in the brain that overloads the sensory so much that a person receives a massive amount of feel-good pleasure. And I won't tell you how great it is, but it is the single strongest pleasurable feeling that a human being can have. And by the way, the first time they get that, and they'll chase it for the rest of their career, and they never get exactly that same again. But it's all happening there in the brain. If you give me the next one, I'll show you where, you see, it's a fancy name down there, nucleus accumbens. But in any event, your brain, the higher thought processes all feed into that and back out. And people think that they're having such a wonderful time, but actually it is just the drug releasing what are called neurotransmitters in the brain. Some people, there are 4 blobs, I call it. Everybody in New Zealand, including you school kids back there, everybody in New Zealand fits in one of 4 blobs. There are people who do not use at all. No drink, no drugs, 0 zip, none, nada. By the way, if you're one of those kids, stay there. You don't need to use. People are going to tell you that everybody uses and you need to use too. Not true. It's your body. You can make up your decision and you don't have to use it if you don't want to. So there's a group of people who don't use. There's a group of people who do use. With alcohol, we call them social drinkers. They use, but they really don't seem to have any major problems. It's not radically affecting their life in any way. There's another group that's called abusers. These are people who do, in fact, have problems as a result of their using. Maybe they have problems in school, they get a drink driving charge, they have some kind of problem, And then there's a smaller group, the fourth group, that have what is called addictive disease, alcoholism or drug addiction. There's some handouts over there that you can pick up later if you want to, that shows how you can actually do the assessment to put people in those 4 different blocks. We call it the Diagnostic and Statistical Manual. It's the international standard we use for assessing. If you'll give me a couple more, I'll show you where the different chemicals work in the brain. There's where it starts in that middle, and it goes out into the other thought processes. Another one, please. Cocaine works in this part of the brain. See the green right there? That's where we know that cocaine and the other stimulants like methamphetamine, it goes into that part of the brain and creates that pleasure pathway where that purple is right there. The next one. Now this is interesting. This is cannabis. It says THC. But if you were smoking pot or some of this chronic, notice the difference. It gets all over the brain. Cannabis, pot, called lipophilic. It means fat-loving. It goes into the fatty tissues in the brain and other parts of the body, and that's why it stays with you quite a long time. By the way, if it was so darn good, why would they call it dope? Just think about that. In any event, next slide. There's some little neurotransmitters in the brain. Click another one. I want to go through this fast. But the way it works is one cell just transfers to the next cell. This happens to be dopamine. And these little dopamine capsules go across the synapses in your brain. This is all going on. I don't want you to learn this. I just want you to know that it exists. That's the way cocaine works. And here's some other model pictures in the brain. One more, please. And we'll stop right there. The point is that it is not a conscious decision. At some point, your brain begins to, in its own way, sort of determine your existence. This is why an alcoholic or an addict cannot always guarantee their own behavior. They may say to themselves and the people they love, I'm not going to do it anymore. They may say to themselves and the people they love, I'm only going to have a little, and then they end up drunk again or high again. And that's vitally important. When you can't keep promises that you make to yourself, you're having a real problem. Now, I wanted to stop. I've got, and if any of you at a school or a church or anywhere would like to know a good bit more about this scientifically, I'd be happy to come out and do it along with me.